the lens that we have in the eye, I don't know if you can sort of get a shot of that.
Yes.
That's sort of the lens that's very clear, and most of us are born with a lens like that. As we get older, now this is sort of an exaggerated version of what a cataract would look
Right.
like, and
Okay.
that lens is very sort of cloudy and
Yes.
dark, and you can
All
imagine
over.
all over.
Define older.
Well, it happens for different people at different ages.
Okay.
Other factors play a part into it as well. So if you, for example, again, genetics plays a part into it. If you're a smoker or if you have a lot of UV exposure, all of those sort of speed up the formation of a cataract.
Right. So if you spent every summer on the lake sailing in the
Yes.
bright sunshine, you may get a cataract before your friend.
That's correct,
Who is in
yeah.
the cabin reading.
Absolutely. But
Okay.
most of us, if we all live long enough, most of us do develop cataracts.
I hear tell. But there's some amazing surgeries now.
There is, yeah. Yeah, the treatment of cataract is really to remove the sort of opaque lens from inside of the eye, and the way we do that is by making a small incision on the cornea, on the very
Right.
sort of front surface of the eye, and putting an instrument, it's a very high-tech instrument called a phacoemulsification unit, and removing the cataract, leaving sort of the capsule or the outer portion of that lens in place, and that forms the bag for an implant lens that will
Right.
be inserted into the eye.
And if you're nearsighted or you're farsighted, can you put in a lens with correction, bifocal lens?
Yes. Yeah, that's...
Or more money, I'm sure.
Well, I
Little
think
extra.
that's a little extra, but I think that's the exciting part of ophthalmology is the availability of all these ways to be able to correct vision to the point where you would be able to see distance and
Sure.
up close. It's not for everyone, you know, the ability to sort of accommodate to that
Right.
type of a lens, but there is definitely a select group of patients who, if they really do not want to wear glasses after surgery, they can opt for a lens that allows them to do that.
A nearsighted friend of mine suggests that she didn't have laser surgery because she was waiting for the cataract
Yes.
so she could get a lens implant.
Yes.
What is your take on laser eye surgery today?
Well, laser eye surgery, again, for this particular person, if they had maybe the beginnings of a cataract, it's not recommended for those patients because the cataract that's another operation that you'd be having in a few years. So you might as well save yourself an operation, have the cataract surgery, and at that point in time, put the correct prescription into the eye with the lens.
Okay.
Generally speaking, I think you mean the laser corrective surgery.
Yes, corrective surgery.
Yeah, that's, I mean, it's, again, huge technological advances have been made even in the last 10 years. The results are very good, but again, it's not for everyone. It's not the type of surgery.
As any surgery, there are side effects.
Absolutely.
And everything may not go perfectly.
You're absolutely right.
But you also may be able to see the clock when you wake up in the morning.
Yes.
If you're
Yeah.
nearsighted.
Well, I think, and that's why it's important to have those discussions with your patient and to see what exactly it is about the way they're currently correcting their vision that is no longer appropriate for them. If glasses are not working, or if contact lenses are bothering them, or if they're getting multiple infections, all of those things may be reasons why you'd want to consider laser refractive surgery.